Good morning, everyone. My name is Jim Stengel, and I am the chair of the Mental Health and Recovery Services Board of Lucas County until tomorrow. I will remain on the board until 2024, but have had the pleasure of serving as the chair of the board for the last 2 years. I want to thank all of you for being here. What's happening today here in our community is very important. If you look around, you'll see people from diverse backgrounds representing much of our crisis care system in Lucas County. We are united by a calling to provide care for people in their greatest hour of need. So what is happening today is very important. On behalf of the Mental Health and Recovery Services Board of Lucas County, of which I'm the chair, I want to make sure that we take a minute to actually recognize that. We began on this road in 2019 when our board convened the Community Psychiatric Emergency Services Subcommittee, or CPAS as it's now been commonly referred to. I had the privilege of co-chairing that subcommittee with Dr. Lois Ventura, one of our community's strongest, most seasoned and tenured leaders in this space. It was open to the community, facilitated by a chosen, nationally recognized consultant. We included staff from community mental health agencies across the community, private psychiatric hospitals, the state psychiatric hospital, crisis service providers, mental health board staff and board members, persons with lived experiences, health plan representatives, managed care, law enforcement, along with numerous other community stakeholders. Folks, it was an exhaustive process, but one that was incredibly important as we move forward. Over 9 months, we examined everything we're doing in our crisis care system, and we imagined what it could be. A number of us on that committee said, you know, we'd like 5 years from now for people from other parts of the country to come here and say, this is what we'd like our crisis services system to look like. Our goal was to create an evidence-based system designed around the best practices everywhere. We created a vision that we believe people will travel here to study. People in need of crisis care in Lucas County deserve no less. The taxpayers of Lucas County deserve no less. We stand today at a key point in our journey to create that system. To everyone who has helped us get there, I say thank you. Don't go anywhere. We need you today, tomorrow, and every day moving forward. To Zepf, we thank you for taking this challenge, our community's challenge. You were part of the CPAS process. We know that you share our commitment to caring for the people of this county. You will save lives every day in this role. We are here to help however we can. I will now introduce Scott Silak, the Executive Director of the Mental Health Recovery Services Board of Lucas County. Scott?
Thanks. Thanks, Jim. I also want to thank everyone for their support in getting us to this point. Your ideas, your passion, your commitment made the CPAS process work. As Jim said, there's more work to be done. Together we'll get there, I promise you that. Representing the staff of the Mental Health Recovery Services Board, I want to extend my appreciation to Zepf Center, both administration and staff who will be carrying out the work over these years, decades hopefully, where we all can be proud of what you're all doing. We appreciate you taking on this role, and we know you will be successful. I know that it's not an easy time for our system as well. Change is difficult, even when it's necessary but beneficial. We should remember that when all the planning is done, all the systems are created, top flight crisis systems are powered by people. When good care happens, it happens at the individual level, between a caregiver and a patient. That's when we make progress. One person at a time, one appointment at a time, one life at a time. We understand that and we honor it. I want the employees of Rescue to know that we honor their work that they've been doing for so many years. On behalf of the board, I've said many times that we will do whatever it takes to assist your transition. We need your talents in our system. I'm happy to see so many of them joining Zepf Center. This is a way to create continuity of care and to benefit everyone involved. And if not at Zepf, we welcome you at all of our other agencies that have many openings throughout our system. Let us know, let the board know what we can do to support you. I will close with this. Crisis care is so important to what we do. That's why we have invested the time in making sure we have the best process possible. Crisis care services must work for everyone, every time. Together, all of us will make it happen. Thank you. I would like to introduce the chair of the board of Zepf Center, Robert Griffey Jr. Robert.
Thank you, Scott. Good morning, everyone. So when Deb Flores, our CEO, contacted me a little over a month ago and said, hey, Rob, we've got an opportunity, but you and I need to talk really fast. And things moved really quickly. And it was exciting, and we were able to bring the senior management together, the board together, and really lay out a concrete plan for how to make this happen. As Deb and I talked through the opportunity to step in, we understood real quickly how important it was and what a big role crisis is in the community, specifically after living through what we did last year. And that's not the last incident that will happen. Other things will come along. So having a very strong crisis management in the community was important. I'd like to recognize the other board members here today: Kathy, Carol, Jim Warden, Nita Madison, Sally. I think you're over there somewhere too. So the board rolled up their sleeves as well. We certainly did not do the heavy lifting. That was Deb and her team that did that, but we were available with our ideas, our comments. Here's ways that we think you can streamline it, make it go quickly, but again, make it so that it's a seamless transition. So appreciate all the hard work that Deb and her staff have done up to this point. The board is committed to helping them with whatever they need in the way of time and resources, because this is very important to sort of a next chapter for us. So again, thank you for being here today, and I'll turn it over to Deb.
Good morning, everyone. Remind me to block Scott Silak's phone number from my phone book. In all seriousness, I think back, Jim, to those days of us sitting in the room talking about improving the crisis system. We listened to law enforcement, we listened to ER doctors, we listened to clinical staff, we listened to managed care plans, we listened to consumers, we listened to finance people, and I'm thinking back, and I wonder if I should have paid more attention. Because little did I know that we would be operating the new system of care in Lucas County. In all seriousness, I think that we looked at the testimony in the CIT officers that provided theirs. I printed it for our staff and I said, here's how we have to improve our relationship with law enforcement, because they struggle just like we do to help people when they're at the lowest point of their life. And so with that foundation and talking to the team, I think about, those Grammy Awards, and people get up there and they thank everyone and they go sit down and they forget to thank a spouse or someone. It is really the staff of Zepf Center, 450 strong. We are affiliated with SEIU Union, which is also what Rescue Crisis had. And we have worked tirelessly over the past 22 days to put together an immediate response to what we need in our community. We're going to ask for your patience because it's going to take us time to build it. And it's going to take us time to work through a lot of different things that our staff works with on a daily basis, but oftentimes we would pass it off to the rescue or to the crisis provider in the community. And I keep telling everyone we're passing it to ourselves now, so we need to think about how that handoff looks and what we'll do different and how we can continue to move to the report that the consultant put together. For those of you that don't know or didn't have a chance to look at it, it is online. And I attend conferences at a national level, and I get to hear about these different types of crisis systems where they're led by law enforcement and medical providers and clinicians. and it's inspiring, and that's where we're going to move towards. Tonight, I'm going to work third shift because at 12 o'clock we're going to turn on the phone lines, and my team, because we haven't been able to hire everyone we need, they stepped up. They said we will work on third shift. I'm not sure how long I'll make it, but I have people here. Last week, Friday, many of them were trained in crisis, an updated training. On Monday, they became certified health officers. Thank you to the Mental Health Board for doing that. And I just want you to know that we are here. We are gonna be we're gonna be your provider, your partner, and maybe sometimes the person that you poke at, because that's what we do sometimes in this community, unfortunately, is point fingers. Well, so-and-so didn't do that, this group didn't do that, and so if you find things and ways that we can improve, tell us. We wanna be better. It doesn't hurt my feelings. How many of you have teenagers? Yeah, I have one, and she tells me, like, why did you wear that? And you said this on TV, and so you're kind of used to being critiqued. So we take it, we take criticism or improvement, that kind of thing. We take it okay. We don't get too offended. And so what I want to talk a little bit about is what we're going to do tonight. So part of this has been us working to phase in how we're going to be able to respond to the community. And so this evening, we have a care line number that we're going to show everyone in a few minutes here. We're going to start taking the phone calls, and we'll be able to answer the 24/7 crisis hotline, as it was called. And we'll also be able to do the recovery helpline. People call, I have a son or daughter who needs addiction treatment. How do I get them in? They won't go. And we can coach them and navigate them through the community and find the right place within less than 24 hours. We know who the community partners are. We want to work with all of them. It's not going to be just a Zepf show. We're not going to only refer to our organization, because that's not using all the talent in the community. And so we're going to turn on the crisis line this evening. We're going to be able to do mobile response tomorrow morning, and then we're going to work. We've been working with individuals to get us the right type of vehicle to transport people when they're not in a voluntary situation. Our goal is really to do the intervention and to do some of the preventative work so that it doesn't always turn into a crisis. And that's the goal. That's the long-term goal. But today we're gonna continue to hire staff to help us build this system of care. But I just want to point to some of the people. I feel like I created the dream team. When I thought about crisis, it was like I immediately wanted to. They're coming this way. I immediately wanted to go out and find the person I knew that would jump into a fire if she could. But I'll start with our Chief Clinical Officer. This is Jennifer Jansen. She has been at Zepf for almost 13 years, and we need to get her to finish that PhD. She's all but dissertation right now. And we have Courtney Burrow, who is going to be our Clinical Director. She is currently working in an ER system in a hospital, but she's worked at Zepf when I started in 2013, and her ability to respond to the community and coordinate care is beyond. How many of you know her? How many of you have worked with her in the community? You know why I went after her, right? So she had to give notice to her current employer, so she's been coming in on her days off, and she officially starts next week. And then we have Steve Colon, who is going to be one of our kind of frontline coordinators, and he's going to assist us with our staff, the boots on the ground. Steve is currently, I met him at our Nebraska location, and he was a case manager. He's the person going out into the field, trying to de-escalate situation, and also coordinating care for the patients that we serve here at Zepf Center. And Steve also has a faith-based background, so I think he really brings a nice flavor to this. That's Steve Colon. And Ashley, we're just meeting. I've heard great things about you. Ashley is going to be the manager of our crisis team, and you also had to give notice to your team, right?
Yes.
Okay, great. And Craig Gabers, for those of you who know Craig, he's been at Zepf Center about 25 years, and he has built so many of our vocational programs and our grants. We now have over $15 million of federal and state grants, and a lot of it is Craig's vision, and he calls himself a builder. And so he's going to be on shift tonight at midnight with me. And then we have James Rye. He is currently serving us as a manager of our suicide prevention grant. And he has really assembled a nice team of peers who have lived experience, who are going to help us do some of the outreach. And he's known nationally for his work that he's put together over time with the peers. And so it's just really exciting. These are kind of the leaders that are molding this and bringing it together. And all the things that we used to complain about, we're going to work on together to ensure that those complaints go away and continue to hire staff. We have a lot more individuals. If you work at Zepf Center, can you raise your hand, please? They're kind of in the back of the room. There are clinical people. There are HR team that has been fast and furiously hiring people. Our IT team, you know, we use an electronic health record system to document, and we want to be able to provide the community regular reports. Who calls us? How often do they call? When do they call? And in what communities do they call from? So we'll be able to give good data on our website through like a dashboard system. We also want to know how many of them are other people's patients. You know, on a daily basis, I'd love to know how many of the Zepf Center patients are seeking services from a crisis kind of environment. And so we're really going to pull together our IT team to ensure that we're getting good data and analytics and putting in safety features to keep our staff safe and the community safe. So we have a plan. It's not all just up here. This team has been working really, really hard, and so have the other Zepf Center staff that raised their hand, our executive team. The board members, thank you for supporting this vision of care. And we're going to take questions, I think, now. Oh, no, I'm going to unveil something. So I thought Scott and I were going to do like draw the system of care and see if it matches or something like that. But this is, thank you to our partners, Communique. We've created a crisis care line, and we also have our mobile response unit that will be available to assist in the community. And so please take down the number, and we're going to load our website today, and so people will be sending out a follow-up to the community partners on this. Now, what we're building in the future is our crisis stabilization unit. This is, for many of you who don't know, this is an old nursing home. My grandfather used to stay here. And we have a 48-bed unit for our people that have addiction issues, whether it's detox, which they call withdrawal management, residential, or a small or lower level of care. So we have that here, and then we have our runaway shelter here. We have our methadone clinic here, and we have the left side of the building is available for us to build a crisis stabilization unit. And so we're going to start working on that. We've been engaging some of our doctors to give us a little bit of a vision from a medical perspective. And then we'll also have the urgent care, which people are used to. Sometimes if patients run out of medication, we will have the urgent care. We need to hire some medical providers to be able to write prescriptions and see patients when they're in crisis. So there's our number. Did I miss anything? Questions? This is never happening. Yes.
Yeah, lots of them. So.
Okay. We could always have you meet with any of the clinical
I'm
people.
already meeting with Courtney after.
Okay, great.
We
Great.
already have that plan.
Okay, good.
So, like, I guess with the bigger things from, like, the hospital perspective, you know, like, for hospital pre-screens, you know, is that still the number? Is this the
Yes.
process still that we call that?
Yes.
So, okay. That was the biggest
We
one.
didn't want to confuse people and have 5 different phone lines going all at once. We're starting basic, you know, with one number that individuals will call, and we'll start to look at the volume. I mean, adding a phone line is easy to forward things. I mean, with technology, we all figured out how to use it pretty quickly with COVID last year. We have the ability for our office phones to ring on our computers. Our clinical staff, they use that because we don't like them to use their personal phone numbers with patients and that type of thing. Yes?
Is it going to be 24/7 intake in the house?
Yes. Yes. 24/7. However, we won't have the crisis stabilization beds on tomorrow, July 1.
I understand.
Okay.
Do people that are coming through EMS need to have medical clearance before they're brought here?
It's a good question. Oh, the question is, do people that are coming from EMS have to have medical clearance before they're assessed? Can we get back with you on that? Let them talk and we'll give you an answer. Okay, well, guess what? We're going to stay here. We'll be over, this is the team that can answer some of your questions, and I will be here as well, and we'll be able to continue to answer questions. We will put those, we'll add that to our Q&A. We have Q&As that we've developed that are on our website, that'll be on our website tonight. so that people have the information. Well, thank you, and again, we appreciate your patience, and let's build this together.